In those moments of darkness and fear, the emergency departments and stroke specialists are the first beacon of light and hope for recovery and rehabilitation. The only thing we ask is do not waste time. Time is brain. Hello, good morning, welcome back to Nursing Stroke Medicine. My name is Chris and today we're gonna discuss about three things we can do if we think we're having a stroke or we are witnessing a stroke happening to someone. First thing is first, we need to call the ambulance. That's the obvious thing, I know, but I'm saying it because sometimes it's not happening. We call the ambulance as soon as we have stroke symptoms. So if you have weakness, facial droop, speech problems, vision problems, expressive word finding difficulty problems, we call the ambulance. You don't go, let's say if you wake up with the symptoms, you don't go back to sleep saying that it's gonna self-resolve when I wake up, it's okay. No, it's not okay. I wish I had a board that says no, it's not okay. Call the ambulance. Stroke symptoms are something you don't need and you don't want to play with. Number 2 of what things we can do if we think we have a stroke, and that is time. Look at the time, clock it. If you have a watch, a wristwatch, if you have a wall watch, if you have a phone that shows the time or any type of device, look at the time when you see your symptoms are starting, because time is of the essence. The time can qualify you for certain treatments for stroke that can and may save your life. So do not waste time. Time is brain. And number three of things that you can do if you think you're having a stroke, and that is to try not to eat or drink anything until you come to the emergency department and you are assessed by specialists. Why am I saying that? Is because with not certain strokes, but with strokes in general, you tend to have swallowing problems, so your muscles don't work very well, and you are at risk of aspiration. The fluid that you try to ingest is gonna go, instead of your stomach, is gonna go straight to your lungs, and that's gonna cause you an infection. And take my word for it, if you have a stroke, you do not want a chest infection on top of that. It's gonna make your recovery and rehabilitation much more harder to achieve. So if you think your symptoms of stroke are there, they're ongoing, don't try to do that. Wait until you come to ED and we can assess, make sure you're safe to do so. And that's pretty much it, guys. Thank you very much. It was a short clip. It's only 3 things you can do if you think you're having a stroke. They're not medical advices, but they're things that should be in your reflex, because stroke is the 4th leading cause of death and 1st leading cause of disability in the world, and unfortunately it happens quite often, so it's nice to be aware of it. Thank you very much, guys. Stay tuned for my next clip. It's coming in a few days. All the best and kind regards.